Hi, everyone. This is Nurse Anna from nursestudy.net, and today we are continuing our cardiac disorder series. This is Endocarditis 25 questions with answers and rationales. Before I forget, I do have free audiobooks via A6 Audible. All you need to do is look at the link in the description, and it's a free 30-day trial. You can get through the book within the 30 days. So please utilize this to get more questions for NCLEX NGN that you can listen to in your car or in the library.
Question 1. A 45-year-old male with a history of intravenous drug use presents with fever, chills, and a new heart murmur. Blood cultures are positive for Staphylococcus aureus. Which of the following is the priority nursing intervention? A. Administer prescribed antibiotics after obtaining blood cultures. B. Prepare the patient for valve replacement surgery. C. Monitor the patient for signs of heart failure. D. Educate the patient about the importance of completing the antibiotic regimen. Answer: A. Rationale: administering prescribed antibiotics after obtaining blood cultures is the priority intervention to treat the infection and prevent further complications. Valve replacement surgery and monitoring for heart failure may be necessary later, but initial treatment focuses on controlling the infection. Patient education is also crucial, but not the immediate priority. Question 2. A patient with endocarditis develops sudden, severe chest pain and shortness of breath. An ECG reveals ST segment elevation. What should the nurse suspect as the cause? A. Pulmonary embolism. B. Myocardial infarction. C. Pericarditis. D. Aortic dissection. Answer: B. Rationale: myocardial infarction, MI, is the most likely cause of ST segment elevation in a patient with endocarditis. Embolic events can lead to coronary artery occlusion, resulting in an MI. While pulmonary embolism, pericarditis, and aortic dissection can cause chest pain, they are less likely to present with ST segment elevation on an ECG. Question 3. A 62-year-old patient with a history of prosthetic valve replacement presents with fever, fatigue, and weight loss. The patient is diagnosed with prosthetic valve endocarditis. Which of the following clinical findings should prompt the nurse to immediately contact the healthcare provider? A. New onset of confusion and altered mental status. B. Development of osseous nodes on the fingers and toes. C. Presence of splinter hemorrhages under the fingernails. D. A persistent low-grade fever. Answer: A. Rationale: new onset of confusion and altered mental status in a patient with endocarditis may indicate an embolic stroke, which is a medical emergency requiring immediate attention. Osseous nodes, splinter hemorrhages, and a low-grade fever are common findings in endocarditis, but do not require urgent intervention. Question 4. A nurse is assessing a patient with suspected infective endocarditis. Which of the following findings would be most concerning and require immediate action? A. Janeway lesions on the palms and soles. B. Hematuria with flank pain. C. A new diastolic murmur. D. Petechiae on the upper chest and arms. Answer: C. Rationale: a new diastolic murmur in a patient with suspected infective endocarditis is concerning as it may indicate valve dysfunction, such as aortic regurgitation, which can lead to heart failure if not promptly managed. Janeway lesions, hematuria, and petechiae are associated with endocarditis, but do not require immediate intervention. Question 5. A 50-year-old male with a history of rheumatic heart disease is admitted with infective endocarditis. Which of the following symptoms should the nurse monitor for that could indicate a complication of the condition? A. Sudden, severe back pain. B. Bilateral lower extremity edema. C. Persistent, dry cough. D. Progressive dyspnea and orthopnea. Answer: A. Rationale: sudden, severe back pain could indicate an embolic event, such as a splenic or renal infarction, which is a serious complication of infective endocarditis. Bilateral lower extremity edema, a persistent dry cough, and progressive dyspnea may suggest heart failure but are less specific to embolic events. Question 6. During the care of a patient with infective endocarditis, the nurse notes that the patient has developed sudden, painless erythematous lesions on the palms and soles. What is the most appropriate nursing action? A. Document the findings and continue to monitor the patient. B. Notify the healthcare provider immediately. C. Apply topical corticosteroids to the lesions. D. Educate the patient about the importance of hygiene. Answer: B. Rationale: sudden, painless erythematous lesions on the palms and soles are known as Janeway lesions, which are associated with infective endocarditis and can indicate systemic emboli. These findings should be reported immediately to the healthcare provider, as they may necessitate changes in the treatment plan. Documentation is important, but notifying the healthcare provider takes precedence. Applying topical corticosteroids and hygiene education are not relevant in this context. Question 7. A nurse is caring for a patient with suspected infective endocarditis who is experiencing persistent fever and night sweats. Blood cultures have been obtained, and the healthcare provider has prescribed antibiotics. Which nursing action is the priority? A. Administer antipyretics as needed for fever management. B. Administer the prescribed antibiotics as soon as possible. C. Ensure the patient maintains adequate hydration. D. Monitor for signs of septic shock. Answer: B. Rationale: the priority nursing action is to administer the prescribed antibiotics as soon as possible to treat the infection and prevent further complications. While managing fever, maintaining hydration, and monitoring for septic shock are important, initiating antibiotic therapy is crucial to addressing the underlying infection. Question 8. A patient with a history of infective endocarditis is being discharged. The nurse is providing education on signs and symptoms that require immediate medical attention. Which of the following should the nurse emphasize? A. Fatigue and mild joint pain. B. Persistent low-grade fever and weight loss. C. New onset of chest pain and shortness of breath. D. Mild nausea and loss of appetite. Answer: C. Rationale: new onset of chest pain and shortness of breath in a patient with a history of infective endocarditis may indicate a serious complication such as a myocardial infarction or pulmonary embolism, both of which require immediate medical attention. Fatigue, joint pain, mild fever, weight loss, nausea, and loss of appetite may occur with chronic conditions but are less urgent. Question 9. A 70-year-old patient with a prosthetic valve is admitted with suspected endocarditis. The patient is experiencing chills, fever, and malaise. Blood cultures are pending. What should the nurse prioritize in the initial care plan? A. Initiate contact precautions to prevent infection spread. B. Begin empiric antibiotic therapy as ordered by the healthcare provider. C. Prepare the patient for immediate valve replacement surgery. D. Educate the patient on the importance of hand hygiene. Answer: B. Rationale: the priority is to begin empiric antibiotic therapy as ordered to treat the suspected infection, even while awaiting blood culture results. This is critical in managing endocarditis. Contact precautions are not typically required unless there is a concern for a specific transmissible infection. Valve replacement surgery might be necessary later but is not the immediate priority. Hand hygiene education, while important, is not the initial focus. Question 10. A nurse is evaluating a patient with infective endocarditis who suddenly develops hemiparesis and aphasia. What is the most likely cause of these symptoms? A. Embolic stroke. B. subdural hematoma. C. Brain abscess. D. Acute encephalitis. Answer A. Rationale: hemiparesis and aphasia in a patient with infective endocarditis are most likely due to an embolic stroke. Vegetations from the infected heart valve can embolize to the brain, leading to a stroke. Subdural hematoma, brain abscess, and acute encephalitis can also cause neurological symptoms but are less likely in this context. Question 11. A patient with endocarditis is receiving long-term intravenous antibiotic therapy. Which complication should the nurse monitor for that may indicate worsening of the condition? A. Recurrent fever and night sweats. B. Sudden onset of severe lower back pain. C. Development of a new systolic murmur. D. Persistent anorexia and weight loss. Answer C. Rationale: the development of a new systolic murmur may indicate worsening valvular damage, which is a serious complication of endocarditis. Recurrent fever, night sweats, back pain, anorexia, and weight loss are concerning but do not specifically indicate worsening of the condition as clearly as a new murmur. Question 12. A nurse is caring for a patient with suspected infective endocarditis. Which of the following diagnostic tests is most crucial for confirming the diagnosis? A. Chest X-ray. B. Electrocardiogram ECG. C. Transthoracic echocardiogram TTE. D. Complete blood count CBC. Answer C. Rationale: a transthoracic echocardiogram TTE is crucial for confirming the diagnosis of infective endocarditis as it allows visualization of vegetations on the heart valves. Chest X-ray ECG and CBC provide supportive information but are not definitive for diagnosing endocarditis. Question 13. A patient with infective endocarditis reports sudden loss of vision in the left eye. What should the nurse suspect? A. Retinal detachment. B. Embolic event. C. Optic neuritis. D. Glaucoma attack. Answer B. Rationale: sudden loss of vision in a patient with infective endocarditis suggests an embolic event affecting the retinal artery. This is an emergency and requires immediate medical intervention. Retinal detachment, optic neuritis, and glaucoma attacks are less likely in the context of endocarditis. Question 14. A nurse is caring for a patient with infective endocarditis who develops a new-onset heart murmur and a petechial rash. What should the nurse anticipate as the next step in management? A. Increase the dose of antibiotics. B. Schedule an urgent echocardiogram. C. Administer corticosteroids to reduce inflammation. D. Prepare for immediate surgical intervention. Answer B. Rationale: a new-onset heart murmur and a petechial rash in a patient with infective endocarditis warrant an urgent echocardiogram to assess for valvular damage and vegetations. Increasing the antibiotic dose, administering corticosteroids, or preparing for surgery may be considered later based on echocardiogram findings. Question 15. A patient with a history of endocarditis presents with a fever, malaise, and a new heart murmur. Blood cultures have been drawn. What is the most appropriate initial nursing action? A. Administer broad-spectrum antibiotics as prescribed. B. Obtain a detailed history of recent dental or surgical procedures. C. Prepare the patient for an echocardiogram. D. Educate the patient on the importance of completing the full course of antibiotics. Answer A. Rationale: the most appropriate initial action is to administer broad-spectrum antibiotics as prescribed to begin treating the suspected infection. A detailed history, echocardiogram, and patient education are important but can be done after starting antibiotic therapy to address the immediate risk of infection progression. Question 16. A patient with a history of intravenous drug use is admitted with infective endocarditis. The nurse observes that the patient has developed new onset hematuria and flank pain. What is the most likely cause of these symptoms? A. Renal calculi. B. Acute kidney injury. C. Embolic infarction of the kidney. D. Urinary tract infection. Answer: C. Rationale: new onset hematuria and flank pain in a patient with infective endocarditis suggest an embolic infarction of the kidney, a serious complication where emboli from infected heart valves lodge in the renal arteries, causing tissue ischemia. Renal calculi, acute kidney injury, and urinary tract infection are possible causes, but are less likely in the context of endocarditis. Question 17. A nurse is caring for a patient with infective endocarditis who suddenly develops hemoptysis and pleuritic chest pain. Which complication should the nurse suspect? A. Pulmonary embolism. B. Pneumonia. C. Pulmonary abscess. D. Heart failure. Answer: A. Rationale: hemoptysis and pleuritic chest pain in a patient with infective endocarditis are concerning for a pulmonary embolism, likely due to septic emboli traveling to the lungs. Pneumonia and pulmonary abscesses could present with similar symptoms but are less immediately likely in this scenario. Heart failure typically presents with dyspnea and edema rather than hemoptysis. Question 18. A patient with suspected endocarditis reports worsening dyspnea and is found to have crackles on lung auscultation. What is the nurse's priority intervention? A. Administer diuretics as prescribed. B. Elevate the head of the bed. C. Initiate oxygen therapy. D. Notify the healthcare provider immediately. Answer: D. Rationale: worsening dyspnea and crackles in a patient with endocarditis may indicate heart failure or pulmonary edema. Immediate notification of the healthcare provider is crucial to assess the need for further intervention. While oxygen therapy and diuretics may be necessary, the priority is to inform the healthcare provider to guide comprehensive management. Question 19. A patient with infective endocarditis has been receiving IV antibiotics for 2 weeks. The nurse notes that the patient has developed a painful, red, and swollen joint in the right knee. What should the nurse suspect as the cause? A. Septic arthritis. B. Deep vein thrombosis, DVT. C. Gout. D. Rheumatoid arthritis flare-up. Answer: A. Rationale: painful, red, and swollen joints in a patient with infective endocarditis may indicate septic arthritis, a condition where infection spreads to the joint space. DVT, gout, and rheumatoid arthritis could cause similar symptoms, but in the context of endocarditis, septic arthritis is most concerning and requires immediate evaluation and treatment. Question 20. A nurse is reviewing the echocardiogram results of a patient with infective endocarditis. The report indicates the presence of vegetations on the mitral valve. What is the primary concern associated with this finding? A. Increased risk of systemic emboli. B. Development of aortic stenosis. C. Formation of pericardial effusion. D. Onset of atrial fibrillation. Answer: A. Rationale: vegetations on the mitral valve in infective endocarditis significantly increase the risk of systemic emboli, where pieces of the vegetations can break off and travel to other parts of the body, leading to complications such as stroke or organ infarction. Aortic stenosis, pericardial effusion, and atrial fibrillation are not directly associated with mitral valve vegetations in endocarditis. Question 21. A patient with a history of endocarditis presents with sudden severe abdominal pain and a drop in blood pressure. What is the most appropriate nursing action? A. Administer IV fluids and monitor vital signs closely. B. Prepare the patient for emergency surgery. C. Administer prescribed analgesics for pain relief. D. Position the patient in Trendelenburg position. Answer B. Rationale: sudden severe abdominal pain and hypotension in a patient with a history of endocarditis suggest a potential embolic event leading to a mesenteric infarction or ruptured aneurysm, both of which are surgical emergencies. The priority is to prepare the patient for emergency surgery. While IV fluids and analgesics are important, they are secondary to surgical intervention in this case. The Trendelenburg position is not indicated. Question 22. A nurse is providing discharge education to a patient with a recent diagnosis of infective endocarditis. Which of the following instructions is most important to include? A. Avoid all physical activity until cleared by the healthcare provider. B. Report any signs of infection, such as fever or chills, immediately. C. Continue antibiotic therapy until the symptoms completely resolve. D. Limit fluid intake to reduce the risk of heart failure. Answer B. Rationale: it is crucial for the patient to report any signs of infection, such as fever or chills, immediately, as these could indicate a recurrence or complication of endocarditis. While physical activity may need to be modified, complete avoidance is not necessary unless advised. Antibiotic therapy should be completed as prescribed, not just until symptoms resolve. Fluid restriction is not universally recommended and should be individualized. Question 23. A nurse is assessing a patient with endocarditis who is receiving long-term antibiotic therapy. The patient complains of new-onset hearing loss. What is the most likely cause of this symptom? A. Ototoxicity from antibiotic therapy. B. Embolic event affecting the auditory cortex. C. Meniere's disease. D. Cerumen impaction. Answer A. Rationale: ototoxicity, particularly from certain antibiotics like aminoglycosides, can cause hearing loss and is a known complication of long-term antibiotic therapy. While embolic events can cause neurological deficits, they are less likely to specifically affect hearing. Meniere's disease and cerumen impaction are other possible causes, but are less relevant in the context of endocarditis treatment. Question 24. A patient with a mechanical heart valve presents with symptoms of endocarditis. The nurse knows that which of the following diagnostic tests is most essential for detecting complications related to the mechanical valve. A. Transesophageal echocardiogram, TEE. B. Magnetic resonance imaging, MRI. C. Computed tomography, CT, scan of the chest. D. Blood cultures. Answer A. Rationale: a transesophageal echocardiogram TE is essential for detecting complications related to a mechanical heart valve in the context of endocarditis, as it provides detailed images of the heart valves and surrounding structures. While MRI and CT scans can be useful for other diagnostic purposes, and blood cultures are critical for identifying the causative organism, TE is the most specific for evaluating mechanical valve function. Question 25. A nurse is managing the care of a patient with infective endocarditis who is experiencing increasing shortness of breath and fatigue. Which of the following diagnostic findings would indicate the development of heart failure? A. Elevated brain natriuretic peptide, BNP, levels. B. Decreased hemoglobin and hematocrit. C. Increased white blood cell count. D. Prolonged QT interval on ECG. Answer A. Rationale: elevated brain natriuretic peptide, BNP, levels are a marker of heart failure and indicate that the patient's heart is under stress due to the inability to pump effectively, which can occur as a complication of endocarditis. Decreased hemoglobin, increased white blood cell count, and a prolonged QT interval do not directly indicate heart failure.